is shaking the table. So. Hello, Bashit Ahmed. How are you doing? Trust you are doing great. Hello, Tunene. How are you doing? Trust you are all doing great today. Hello, Emmanuel. Hello, Wise Madine. How are you doing? I'm doing well. I'm doing great. It's nice having you all on my live today. So I'll just go straight since we have a lot of people already waiting for today's live. Good day, everyone, and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. If you are coming across this channel for the first time, all you have to do is to subscribe to our YouTube channel and also check out on our old and previous video. So we have Akim Godom, we have Wenke Esther, and we have Wise Madine. Welcome to this section of today. Welcome. So it's the welcome period. If you're watching, just drop in the comment section. Let me know where you are watching from. Say hello, say hi. Let me know where you are watching us from. And don't forget to double tap the screen and actually like this live section. It promises to be engaging. It promises to be interacting. There's going to be a lot of questions at the end of this live section. So all you just need to do is to stay from the beginning to the end and get all the necessary information you need in regards to low sperm counts. So we have Akim Gordon watching from Jamaica. Hello, Akim Gordon. Then we have John Essien. Hello, Nurse. Hello, John. How are you doing? Trust you are doing great. How is Jamaica, Gordon? Hope Jamaica is great. So I believe from the title of this particular video, we already have an idea of what we are going to be discussing today. So we're going to be starting in the next 2 minutes just to give other people time to get the notification and rush down. But while we are waiting for other people to pop in, we're just going to be doing some introduction in the comment section. So we have Josh Kryptonite. Hello, Josh Kryptonite. How are you doing? Trust you are doing great. It's a beautiful evening over here. So we have Wenke Esther is watching from Aba, Nigeria. Thank you very much, Wenke Esther, for joining us. Then we have Christopher Pamba. Christopher, hello, how are you doing? Trust you are doing great. How you are doing? Okay. I think I've mentioned Josh Kryptonite. Josh said, hi, Nurse, I'm doing great. It's nice to hear from you all today. So this most times, or not most times, nowadays, our topic are usually gotten from the previous live. So yesterday we asked on which topic people would like us to discuss, and everybody voted. About 77%, 79% actually voted and said we should talk about low sperm counts today, the various causes of low sperm count. And we had no choice than to do this particular topic today. And I believe everybody is anxiously waiting to know what it is and also get an idea about it and know what to do, especially if you are a man and you are planning to get your wife pregnant and you're planning to have kids. So this is very, very important, and this is also very paramount. So we have Diamond Weight Loss. How are you doing? I know it's stinking. I don't really understand what you mean by it's stinking, but we are doing great and we are doing extremely fine. So Bashit Ahmed said she's watching from Nigeria. We have Dancom Media watching from Uganda. We have Josh Kryptonite. Okay, great topic. Yeah, it's actually a great topic, especially for the men. So if you are watching this video, you have anyone that has issues with fertility, you've ever thought about it as a man that is planning to get pregnant in the future, or you have gone for semen analysis and the doctor actually said that, oh, there is a low sperm count, I think this video is for you. You have to watch, learn, because on this particular video we are going to be diving into what low sperm count is all about. We are going to be talking about the causes of low sperm count, how to prevent low sperm count, and the treatment available when it comes to low sperm count. We are going to be discussing all this in this live section. So we have Gabriela Noyen. Gabriel Anoye, I came live this morning, but I could not see you on the live section. I really wanted to help you out with your cycle, but you were not online today. I actually did a live video today just because of you, but I could not find you. So after some time, I think I spent up to like 30 minutes on the live section, but I left on time to do some other stuff. Okay, so Christopher Palmer said, I'm good. How about you? I'm doing great. So now it's 6 minutes. Let's go straight into the points. And the point is low sperm count. Low sperm count in medical term, it is known as oligospermia. Oligospermia. Now you may want to ask, oh, when the doctors do the analysis, how do they know that I personally have oligospermia, which is low sperm count? When the doctors say you have oligospermia or you have low sperm count, it simply means that you have less than 15 million sperm, less than 15 million sperm per milliliter of semen. Let me explain what that means. Let me go over it again and I will explain it in a simple term. When the doctor says that you have oligospermia or low sperm count, it simply means that you have less than 15 million sperm per milliliter of semen. What do I mean by that? So as a man, when you ejaculate, when you release, like during sexual intercourse, you release, that semen that you release, 1 milliliter, that's 1 ml. For those that have seen syringes before, the smallest syringe, 1 ml, that 1 ml has to have at least 15 million sperm in it. It has to have what 15 million sperm. For those that don't have idea of what syringe is, like a small cube, that's what like the meal we are talking about. So you can see as a man, you have millions of sperm. We're not talking about we're not talking about 10 million. We're talking about more than 15 million of sperm per 1 meal, which is very minute, which is very tiny. I wish I have a syringe here. I would have illustrated it better. So when they do that test, they see that the sperm in that semen is not up to 15 million per meal. They tell you that you have oligospermia. All right. So we have Christoma Palmer. We have Florence Azubike. Florence Azubike, how are you doing? Trust you are doing great. We have Diamond Weight Loss saying hi. How are you doing? Then there's something I want you to know. You see this issue of low sperm count. You see this issue of oligospermia. Do you know that sperm count has been declining globally over the past 40 years? Like over the past 40 years, it's not like a one person thing, it's worldwide. It's affecting, like it's all over the world. There's a decline in sperm count over the years. For the past 40 years, sperm count has been reducing. What it simply means that men that are coming for tests, those that are having low sperm count is on the high side. It keeps increasing every year for the past 40 years. So if you are a man and you've just been diagnosed of low sperm count, or in your test results, it is written oligospermia, it simply means you are not alone. There are a lot of people out there that have been diagnosed of this oligospermia. Okay, so we have Gabriel Oye said, good evening, nurse. I did not meet up in time. Chai, I miss you, watching from Lagos, Nigeria. All right. So, and also as a man, when you ejaculate, that thing is not just sperm. That thing is not sperm. When you ejaculate, it is not sperm. It is known as semen. So inside that semen, that's when you have the sperm inside. All right. So most people, men will say, oh, I ejaculated. That simply means I'm fertile. No, there are some men out there that they will ejaculate and there is no single sperm inside. There's what we call low sperm count. There's also another condition in which there is no sperm at all. All right. There's a condition in which there is low sperm count, and there's also another condition in which there is no sperm at all. So it's not just about ejaculating. If you ejaculate, how many sperm is inside? Is it more than 15 million per milliliter of semen? So that is what they are analyzing, and that is what they are checking. So I want you to know that low sperm count is real, and it affects millions of men, often without symptoms. You know, we don't actually take these sperm count issues into consideration, except we are trying to conceive. Except, oh, this is a couple, they've been trying to conceive, you and your partner have been trying to conceive, it's not forthcoming. That is when men decide to, okay, let me go and check. They said to go for semen analysis. They check and they say, okay, you have sperm count. Low sperm count does not have signs and symptoms. Low sperm count is not written in the head, in the forehead. In low sperm count, you can ejaculate, you can have sex very well, but the semen doesn't have enough sperm. So there is no sign, there is no symptoms when it comes to low sperm count. So then that takes us to the major topic of today, which is the causes of low sperm count. In this particular video, I actually divided the causes into 3 parts. We have the lifestyle causes of low sperm count, we have the medical causes of low sperm count, and we have the environmental causes of low sperm count. So I'm going to be explaining it in details, each of them, so you have an idea. Like I said, we have the lifestyle causes, we have the medical causes, and we also have the environmental causes of low sperm count. So Diamond Weight Loss said, do you think you should save your semen for Jesus? I don't know what you're saying, Diamond. So we have Christopher. Christopher said azoospermia. Yes, azoospermia is a condition in which there is no sperm at all. There is no sperm in the semen. There's no sperm in your ejaculate. So let's go back to the causes of low sperm count. The first one we're going to be talking about is the lifestyle. As the name implies, it simply means what you have control over. Lifestyle most times is what you have control over. And the first thing that causes low sperm count is smoking. You heard me right. Yes. Tobacco actually lowers the sperm count and damages the DNA. Tobacco lowers the sperm count and damages the DNA. So if you are trying to conceive and you've been smoking, it's advisable you stop because you are trying to conceive. Then the second thing that causes low sperm count is alcohol. Let me tell you how alcohol causes low sperm count. Alcohol, which is excessive drinking, actually reduces your testosterone. And when your testosterone is reduced, there's disruption in sperm production. We all know that testosterone is the male hormone. And alcohol, when you are taking alcohol, it reduces that hormone. And when that hormone reduces, it affects your sperm production. So if you've been trying to conceive and you are drinking, I will advise you to stop drinking because you are trying to conceive. Then the third lifestyle causes of low sperm count is actually drugs. See, for those that are abusing drugs, for those that are taking drugs, this can actually affect your sperm count. Those that are taking steroids, marijuana, certain medications, they are known as sperm killers. So if you are taking steroids, if you are taking marijuana, you are abusing different drugs, and you are trying to conceive, I will advise you stop that. Okay? Stop the drug abuse. All right? So then that takes us to the other one, and that is obesity. Yes, obesity. Because excess weight gain actually throws your hormones off balance. You see, weight gain, it throws your hormones off balance. It's not only the men, it also affects the women. So if you are having excess weight gain, it disrupts your hormone. And when someone is excessively fat, like there's going to be heat in the testicles. You know, heat, like this person is going to be sweating. And you know, the testicles is actually, the way it's been designed, it's designed to be outside because it doesn't require heat. If it's inside the body, heat is going to destroy it. Okay, so that is why the testicles is outside. So if someone is obese, that can actually increase the temperature of around that testicles and actually damage the sperm. So that's something you should take note of. Then another is chronic stress. Sometimes we actually underestimate stress. You see this thing called stress. Stress has a role to play when it comes to our full body. Stress affects our full body and it affects sperm production. Stress, messes your brain signal to produce sperm. So these are the lifestyle factors that actually causes low sperm count. These are the lifestyle factors that actually causes low sperm count. So Westin says, has smoking affected? Yeah, it lowers the sperm. It lowers the sperm and it also damages the DNA. That is how it affects the sperm count. All right. So I have a question before we go to the environmental factors. Before we go to the environmental factors that causes low sperm count, I have a question for you, and feel free to drop the answer in the comment section. So which of all these lifestyle I have listed do you think is common among men today? Drop your answer in the chat. Please, I'm waiting. I've listed smoking, I've listed alcohol, drugs, obesity, and chronic stress. So which of these lifestyle I've listed today do you think is common among the men today? Which of them do you think is common? So this is the lifestyle. We're going to be talking about environmental, and we're still going to be talking about medical causes. So JJ said stress. Okay, you feel chronic. Wow, stress. Yeah, that's nice. So it's obvious that stress could probably be one of the causes of low sperm count. So Coach Olawole John said chronic stress. Wow, I never expected this answer, seriously. Wise Man Dean said stress too. Diamond Weight Loss said smoking. What view? How are you doing? Trust you are doing great. It's nice having you. What view said na stress. So Christopher Pamba said, welcome to Tanzania. How are you doing? We'll talk about how to increase it. We're taking it one step at a time. We have to explain the causes before we talk about that, before we talk about how to stop it and what you can do. Okay? So Florence Azubike said smoking and alcohol. From the votes, like from the answer so far, it is obvious that stress is one of the major cause of low sperm counts today. I never expected this answer though. I was thinking people are going to say smoking and alcohol, but from the answer, I've come to think about it, and I think people are right. Stress could actually be the cause of low sperm count in the world today, because this is there's a lot of inflation, economic issues, war here and there. That is enough to cause stress, and that is enough to cause reduced sperm count. All right. Does not smoke. No, I don't smoke. So that's that. Now let's go to the environmental factors that causes low sperm count. What do you think? Which of the environment? Okay, let me explain it first before I'll ask you a question. That's the best, because I'm teaching. So in terms of the environmental factors that causes low sperm count, we have heat exposure. Heat exposure. You see those hot tubs that you used to go? I know those hot tubs are pretty cool. Yes, hot tub, tight underwear. You see all those guys that used to wear those tights, that underwear that looks like pants. Stay away from it if you want to protect your sperm. Then those guys that used to put their laptop on their lap, well done, well done. So these are actually environmental factors. They heat exposure, they expose you to heat. They expose that area to heat. So if you are trying to conceive and you are battling with fertility, it's important for you to save the sperm you have by avoiding tight underwear, avoiding hot tubs, and avoiding putting your laptop on your lap, because it's going to cause heat. Your testicles does not need heat. Your scrotum area does not need heat. So if you keep putting heat around that area, it's going to be bad for you. So another environmental factor that can cause low sperm count is toxins. Toxins. Chemicals like pesticides. You see those pesticides? Yeah. And also BPA found in plastic. We've been hearing that, oh, plastics are not good for you to preserve food. Plastic is this. So those BPA found in plastic can actually mess with fertility. So that's something you should take note of. So I have a question for the men on this live section. You know what I explained? I asked my own question, okay? So how many of you have sat with your laptop on your lap for hours? Have you done that? How many of you have sat down with your laptop on your lap for hours? If you have, drop on the comment section and say, I am guilty. How many of you men have sat with your laptop on your lap for hours? Drop on the comment section. And if you are watching this video, you are coming across this channel for the first time, my name is Mercy Mary. I am a registered nurse midwife. And here we talk about health. All those questions you are scared to ask your doctor, just bring it down. All those questions that a doctor don't have time to explain, just bring it down. We'll try as much as possible to explain it in the way we understand. And if you cannot, we advise you to contact your doctor again. All right. JJ said he's guilty. Diamond Weight Loss said, not me, to be honest. That's good. Wise Madin said, accept me. That's good. So we have a lot of men that are not putting their laptop or their laps for hour. All right. So it seems when you see that laptop putting it on the lap, it looks harmless, but it can raise the testicular temperature and actually affect the sperm. So now you know about the lifestyle causes of low sperm count. You know about the environmental causes of low sperm count. It's time for us to talk about the medical conditions that can cause low sperm count. So if you see that you are free from the lifestyle causes, you are also free from the environmental causes, you are not guilty. So let's check the medical conditions. There are also some sicknesses, there are some medical conditions. I'm trying to break it down like some disease. Should I call it disease now? In a way you understand. So medical conditions that can actually affect sperm count. Sorry. And one of these is varicocele. Varicocele. Varicocele is the enlarged vein in the scrotum. When the veins in the scrotum are enlarged, they are swollen, it can cause heat. It can overheat the testicles. It can make the testicular temperature increase. I like breaking it down as much as I can. It can make your testes hot. Yeah, let's put it that way. But I believe you understand what I mean. So varicocele is the enlargement of the veins. Veins, like, for example, this is the vein in the testicles. When it's been enlarged, that is varicocele. And when it's been enlarged, it increases the temperature around the testes, which is not nice. And remember, like I said, the testis does not need increased temperature. That's why it is even outside in the first place. So the second thing that can cause low sperm count is actually infection. Yes, you heard me right. MOPS, sexually transmitted infection, can actually reduce sperm production. So if you have STIs, it can reduce your sperm production. Then the third one is hormonal imbalance. When people hear about hormonal imbalance, they feel it's only the women that battles with hormonal imbalance. But in the recent, men also battle with hormonal imbalance. All right, the brain and testes, that's the brain and the testes, must work together in order for sperm production to take place. So if the sperm and the brain, they are not working hand to hand, they are not working as partners, it will be difficult for sperm production to take place. So if anything interrupts the production of these hormones, definitely sperm production has been affected. Then what we call them genetic condition. Just some men are born with conditions which is known as Klinefelter syndrome. Klinefelter syndrome. So this syndrome actually affects the sperm count. So these are the medical conditions that affect sperm count. And also, this is an addition, if the tube that carries sperm from the testes to join the semen is actually blocked or is cut off, like vasectomy, that can cause low sperm count or no sperm count at all. And also for kids, if their testes did not descend, is inside the body, that can actually affect sperm counts. So that is why when kids are born, a male child is born, the doctors, the midwives actually examine their testes just to make sure that after a particular day, the two testes have descended into the scrotum. Because if the testes did not descend into the scrotum, that is an issue that needs to be sorted out. So that is the medical condition that causes low sperm count. Then in addition, the medications you take. What drugs are you on? You heard me right. Yes. What drugs are you on? There are some drugs which you take because you need them. For example, some chemotherapy drugs. Yes. For those that have cancer and they're having some chemotherapy, that can affect sperm count. Some antidepressant, for those that are battling with depression and they are taking some antidepressants, that can affect the sperm count. Some antibiotics and antifungi can affect sperm count. So I think that is something you should take note of. Generally, I advise individuals that when you are trying to conceive, check your lifestyle, check the medications you are taking, check the environment, and you're going that's things I said you should check. It's going to give you a clue to know if you are lacking behind, if there is something you need to do away with, if there is something you need to hold on to actually boost your fertility. So when it comes to fertility issues, it's not just about the woman the men is also to be heard, like they should be heard. Which word should I be used now? I'm thinking of the right words to use. The men, we should hold the men. We should hold the men. It's not only the women they should blame. We should also blame the men. You get? I think when it comes to fertility issues, the men and the women should work hand in hand to actually get it sorted out. So it's not just a man thing, it's not just a woman thing, it's a both parties thing that everybody needs to work on. Okay? So I have a question now. I'll finish teaching that section. Let me ask you a question. Are all medications safe for fertility? Yes or no? Are all medications safe for fertility? Yes or no? With this, I'm able to know if you are following or not. All right? Wenke Esther said it will be 50-50. Yes, it will be 50-50. Yeah. So Diamond Weight Loss say no. Blessing Duru. Blessing Duru, it's been long I saw you on my life. How are you doing? Trust you're doing great. Blessing Duru said no. Okay, I'm waiting for more answers. Are all medications safe for fertility? Yes or no? Wise Madine said no. Blessing Duru said I'm good. Nice having you on the live today. Yes, I said some antifungals do. Yeah, I said that. Wenke no. McDonald Ebube said no. Yeah. So some medications affect fertility. If you are trying to conceive, it's advisable for you to speak with your doctor if there's a way they can stop some medications and put it on hold. Even for the women, some medications affect their fertility. It alters their hormones. It alters their cycle. And when a woman's cycle is not regular, getting pregnant might be a problem. All right. I think that is that. So people will be talking about age. Yeah. I know people want to talk about age. This is an addition to the courses. This is bonus points to the courses of male fertility. What did I say? Sorry, I'm carried away. This is one of the causes of low sperm count. Please and please pardon me. All right, age. So yes, we've seen children from parents that are 60 years, 70 years. We've seen older men, they are able to father children. It's possible. I'm not disputing the facts. But as you age, the quality of your sperm decreases after age 40. So after age 40, the quality, I'm not talking, it's not just quantity when it comes to low sperm count. I think that's something I should discuss after this, what I'm talking about now. So as you age, the quality of your sperm drops after 40. So it's not just about you have enough sperm, how far the quality. So with age, there's higher risk of genetic mutations in sperm. You know, like genetic changes in your sperm. As you age, the quality of your sperm is no longer as strong as it was. So with age, the quality decreases. Okay, the quality what decreases. That's something you should also take into consideration. And when you go for semen, they said, oh, you have to check your sperm. You're trying to conceive. You have to go for semen analysis. They're not just counting the number of sperm. Oh, 50 million sperm. Boom, you have 50 million sperm. Boom, your sperm is okay. No, they are checking for the shape. They are checking for the movement. They are also checking the quality, the quantity. That's what they are checking. So sperm count is not about how many sperm is there. Sperm count is about, are they moving? Like in our last section, somebody talked about actinospermia, in which you have sperm, but the sperm are not able to move well. So that's something they also consider. Are the sperms you have, are they moving? Are they in the right shape? Are they in the right order? So, but as an individual age, the quality decreases and mutations take place. All right, so that's one thing you should know. So I want to drop a question again, because I like asking you a question, because the more I ask you, the more it's more engaging. It's like a me and you thing. I'm learning from you, you're learning from me. At least today I've been able to learn that stress is one of the major cause of low sperm count in men. You people made me understood that. You people made me think in that direction. Stress. Men out there are being stressed out. So stress is a major cause. So my question for you, do you think men should start considering family planning just like women do? You know, in our previous section, we talked about vasectomy. Do you think men should, that they should take the lead when it comes to family planning? Yes or no? If you've not watched our live section of vasectomy, feel free to go and watch it. So do you feel men should start taking family planning seriously than the women? I want to know in the comment section. Is it a yes or a no? Yes, men should take it. No, men should not. Can you drop on the comment section before I go to what you should do as a man? And if you are watching this live video, all you have to do is to double tap the screen, and like the section. What's this? Oh my God. Okay, why is Steven said yes? Thank you, Steven. Why is Madine said no? Why is Madine why don't you want men to go into fertility? Like, why don't you want them to go into family planning? Why don't you want them to do it? I would like to hear from you, Wise Madine. Blessed Duru said yes, men should consider it. Francis Manley said, how is sperm culture done and does it check for everything? Christopher, okay, I'm going to be telling you how it's been done. Okay, so let's answer Francis Manley question. He said, how is sperm culture done and does it check for everything? Yes, when they take they ask you to ejaculate and bring the sample. I think you have to ejaculate. I think when you visit the doctor, you have to ejaculate and give them the sample. All right. So when you give them the sample, they take it to their lab and analyze it. So during the process of analyzing it, they don't only check for the quantity, they check for the movement, they check for everything. It's not just like the number they check. They check for everything and let you know the outcome. So it's not just one thing they check. So Christopher Palmer said, is there any treatment for azoospermia? I will say a treatment for it, depending on what is causing it or what caused that azoospermia. If it's a condition in which your vas deferens is affected, it might be difficult. So it all depends on what is actually causing that azoospermia. That's the question. What is causing the azoospermia? But if the doctor says you have azoospermia, what I would advise generally is to, you've known what has happened, you know, like, okay, and I have azoospermia, start eating healthy, quit alcohol, quit smoking, live a healthy life, get the prescribed antibiotics. The doctors are going to recommend some vitamins for you, like zinc, vitamin E. They are going to tell you the vitamins in particular they want you to take. All right, they are going to tell you, so you have to use it when the doctors tell you that. So that's the treatment I can say for the now. So the next question is, as a man, what can you do? Like I earlier said, I think I've just given a summary of what I said. The first thing is, the game is to get tested as a man. It's very important for you to get tested. Just go and get your semen analyzed, especially if you are trying to conceive. Quit smoking and quit alcohol, not just cut down. Then if as a man you are obese, try losing some weight. Like I earlier said, excessive weight causes unnecessary heat. If you can't, try and lose some weight. Eat antioxidant-rich food. Eat antioxidant-rich food. When we talk about berries, nuts, leafy vegetables, that's what should be on your diet. Berries, nuts, leafy vegetables should be on your diet. Avoid heat to the groin area. So if you know you used to sit for a very long period of time, the laptop's on your lap, you used to do hot tubs, quit it. Avoid that for a very long period of time. And if it's a result of infection, for example, an STI, get the infection treated as soon as possible. Okay? With small lifestyle changes, medication, and a visit to your doctor, it's going to make things work out. All right? Yeah, weight gain, obesity affects sperm. Yeah, someone is too big, it affects sperm. It's not just only in men, it affects women too. Obesity affects women too when it comes to giving birth to kids. Obesity affects women. So now it's your time to drop your questions in the comment section. I'm done with all I have to share with you today. I've talked about the causes, I've talked about the treatment, I've talked about what you need to do. So It's your turn for you to ask me the questions. Godsin, Newman's head high. Hello, Godsin. How are you doing? Trust you are doing great. So feel free to drop your questions in the comment section. Feel free to drop your comments in the comment section. Or questions, questions in the comment section. So maybe someone will want to think about what food can I eat to actually improve the sperm count. Do you have any idea? Drop in the comments. Since somebody is asking a question, so I want to ask you a question. Do you have any idea of the best food to eat to actually improve the sperm count? What food do you think you can eat to improve the sperm count? Your suggestions in the comment section before I tell you my suggestion. What food do you think is best to actually improve the sperm count? Drop in the comment section. At least everybody should be dropping one or two. What food? Diamond Weight Loss said, do you think you should save yourself for marriage? Yeah, if you can, you should. Yeah, you should. Yes, I think so. Okay, zinc supplements, yes. All right, I'm talking about the food, like food you can easily get. You get not the supplements you buy. Blessed Drew, you're so funny. Blessed Drew said ogbono soup and okra soup with small portion of gari. Is that what you had for dinner, Blessing? A Blessing, is that what you had for dinner? Please, if you are watching this live video and you've not double tapped to like the video, kindly do so now. We've been talking, we've been discussing for long. Kindly do so, double tap, like the screen. Okay, Blessing Drew said no. Diamond Weight Loss said garlic. So I'm going to share with you some suggestions when it comes to food that actually helps to boost your sperm count. The first one I have to share with you is walnuts. Walnuts. I don't know if you've heard about tiger nuts. Okay, that's rich too. I don't know if you've heard about walnuts. Nuts are generally healthy. Nuts are generally good. Tiger nuts are good. Walnuts are good. All right, thank you, Steven. Then we have leafy greens. For those in Nigeria, your ugu leaf, your water leaf, they are good if you're trying to improve your sperm count. Then spinach, all these leaves are anything leafy green, anything green vegetable, your shoko, the vegetables are anything thank you, Godson. Vegetables are good. Then citrus fruit, like oranges. Citrus fruit are very, very good. It's better for you to take it. Then you can include daily egg intake in your diet. Take egg. I know you tell me, oh, Nurse Mary, you said obesity is not good. Egg doesn't make you fat if eaten in the right proportion. Okay, so take eggs. Eggs are very good. Salmon, sardines. Yes, sardine fish, salmon, they are rich. Pumpkin seed. Pumpkin seed is rich. So these are healthy food you can actually eat to help with sperm production. Just Krypton, I said, all right, plantain. All right, plantain, we are with some vegetables by the side. It's very good. All right, plantain with some vegetables on the side is very good. Yeah, dates are good, Stevens. Dates are actually good. Studies have shown that it helps with the sperm motility. So dates are good. Dates are good. You can prepare your tiger nut juice with some dates in it. They're actually good for sperm. The Diamond Weight Loss say, are you going to do a poll? Yeah, I'm going to do a poll at the end. We're going to be talking about, we're going to do a poll on the next topic to talk about tomorrow. So that's that. But I just want to finish up before we do a poll on the topic to talk about tomorrow, diamond weight loss. So I've listed some food that you need, but food rich in zinc, they are very, very important when it comes to reducing sperm counts. All right. And I want to ask a question in the comment section. Has anyone at all in the comments, like in our audience, has anyone gone for semen analysis before? Has anyone gone for semen analysis before? Has anyone gone to the lab for semen analysis before? McDonald Ebube said, this is my first time of coming to your live. I have really learned a lot today. You're welcome. All you have to do, McDonald, is to subscribe to our YouTube channel and also check out on our videos. We come live every day, and our next topic is going to be determined by the votes we get and the suggestions of today's live. So that's what is going to determine our next topic tomorrow. So our live sessions is from 10 to 11 p.m. every day. All right. So Stephen said no. Pan-African Spirit said yes. Diamond Weight Loss said no. Blessing Duru said I'm a female. That's okay. So if you go for test, like I earlier said, the normal sperm count per milli. I just wish I have a syringe with me so that I understand. I will explain to you what 1 ml look like. Inside that 1 ml, 1 ml is very small. 1 ml of semen is very small. There should be 15 million or more. That's the normal. If it's above 15 million or more, your sperm count is okay. Then when you say, okay, the person have a moderate sperm count, is between 5 to 15 million. Then if you say, this person have low sperm count, is low, this person needs to boost it very well, is 5 million. You can see it's even plenty, but in the egg side, in fertility side, is not plenty. 5 million is not enough. 5 million pounds is not enough. 5 million naira is not enough. But we should be talking about 15 million and above for you to say, this person is ready to father a child. All right. So Christopher Palmer, I don't know what your results is like, but if you check the figure, you're going to be getting normal, moderate, or low. If they say your sperm count is low, it simply means the sperm count is below 5 million. If they say it's moderate, it simply means it's between 5 to 15 million. And if they say it's normal, it simply means it's above 15 million, according to the World Health Organization. So it's the World Health Organization standard I'm using to give you this. All right. So we have Steven said, please, how much will it cost for the test? That I can't say. It's going to be determined by the location. For example, the cost they will charge in the UK is going to be different from the cost they will charge in Nigeria. And even inside that same Nigeria, the cost that they will charge in Lagos Island is different from the cost that they will charge in Lagos mainland. The cost in Lagos will be different from the cost in Edo, in Ibadan, in Imo State. So it all depends on the location. So what I would advise you to do is to check for a hospital around, compare prices if it's too much, and see how it goes. Okay, Steven said I'm in Ghana. So the cost is still going to be different in Ghana. So I can't really, I don't even know seedings. I've not spent seedings before, but I have a lot of Ghana friends. But I have not touched seedings. I think I should meet one of them to give me some seedings. Let me see how Ghana seedings look like. But anyway, I'm not in Ghana, Steven, but you can check in the nearby hospital. I know most of the times we want to do it in a code so that people will not suspect that we have fertility issue. So you can just go to any one hospital and just do it and just pay the money without pricing, without comparing prices. You understand? Because people like, if I see this hospital, people will think I have fertility issues. So let me just codedly run the thing without your next door neighbor knowing. You understand what I'm saying anyway? Yeah. So that's Steven. So Blessing Duru said, nurse, please, what can I take during 2 weeks? Wait, please prescribe. Is it 2 weeks of pregnancy? 2 weeks? I don't really understand, Blessing. I don't understand, Blessing. Are you 2 weeks pregnant and you are looking for what to take? So your question is not clear. Please in the comment section, while we are waiting for Blessing to clarify, please drop in the comment section what you would like us to discuss in tomorrow's live section. Drop in the comment section what you would like us to discuss tomorrow. Any topic that's bothering you and you want us to expatiate, elaborate it. Blessing Duru said, waiting for implantation. Did you do IVF? It's not really clear. How are you sure you are pregnant and you are waiting for implantation? Generally, what I advise in the early stage of pregnancy, folic acid should be your best friend. Yeah, so folic acid should be your best friend if you are trying to conceive. So folic acid is very important. That's what I advise women to take. Folic acid is very important. There's some vitamin like vitamin D is also very, very important. Folic acid, vitamin D is very important. Then if you can get this preg care, you can also get it. Someone said vitamin E. I don't know about vitamin E, but the two vitamin I know that is very important is folic acid and vitamin D. But you can get the preg care. Preg care contains all the vitamins in general. But the two, during my time, I'm not saying this is me. During my time, the two vitamin I take, I didn't use preg care. I didn't use any. I just took folic acid and I took vitamin D during my own time. So, but if there's you are having low vitamin E, you can take it. Then, if you want some other vitamins, you can use preg care. Okay. Florence Azubike said ovulation. Do you want me to calculate your ovulation for you? Or I actually came live to talk about ovulation, but we didn't get you. But if you want us to talk about ovulation, and I have my board here, but I can use my phone to do the live sections to help you calculate your ovulation, because it's a front camera, so it's going to mirror the image. So if I'm to do the live section on ovulation, I'll have to end this live and use my computer and the camera to actually do the live on ovulation. So is it knowing how to calculate your cycle you're talking about, Florence? Aside ovulation, what do you want us to talk about? We can deal with that ovulation, depends on the vote. If we can deal with that ovulation, let us know what we are to talk about tomorrow on tomorrow's live section. What do you want us to talk about on tomorrow's live section? Let me know in the comment section. Tomorrow's live section, what do you want us to discuss? Oh. What do you want us to discuss in tomorrow's live section? What do you want us to discuss in tomorrow's live section? Drop in the comment section if you have any idea. But if there is no idea, I'm going to be picking a topic of choice before the live section tomorrow. But if you have a particular topic you want us to talk about, drop. Oh, PCOS. Okay, that's one. We'll talk about PCOS. Any other person? Another person that want us, if there is no competition between the topics, we might talk about PCOS. So if you have something else we should talk about tomorrow, drop in the comment section. And also, we have a lot of people watching. Why don't you double tap and give me some thumbs up? Thumbs up to this live section. It's been interesting, you agree, it's been engaging, and it's been educating. So, and if you are just coming across this channel for the first time, my name is Mercy Mary. I am a registered nurse midwife. And also, please subscribe and check out our previous videos. You're going to be seeing me more on my live series because I'm going to be doing more of the live sections so that I can hear from you. I can attend to you directly. All right. So if we don't have any competition, we might be dealing with Blessing Drew's question, which is PCOS. Blessing, make sure you're live tomorrow at 10 p.m. We are likely going to be talking about PCOS tomorrow. So if you have a colleague, a friend that really wants to know about PCOS, introduce them. Let them come to Nurses Lecture Room. Let them come to Nurses Lecture Room. Tell them to come and watch our video. Tomorrow by 10 p.m., we're going to be talking about PCOS. Don't forget to share. This is like a fertility. It's not really just fertility, We'll talk about health in general. So don't forget to share to all your friends. Let them join us tomorrow by 10 p.m. as we talk about PCOS. Okay, Florence Azubike said, I want us to discuss everything about ovulation. Okay, let's do a poll. I think PCOS can also be discussed under ovulation, but let's do a poll. Should we title tomorrow's video PCOS or ovulation? Let's do a poll. The winner we go. And most of the people for the live are already gone. Ovulation, PCOS. Kindly do a poll. Tomorrow's topic. Okay, just vote. I've done the poll. Yeah, the poll is there. Tomorrow's topic, PCOS or ovulation. Voting starts now. Voting starts now. So if you want PCOS, vote. If you want ovulation, vote in the comment section. Let's vote. Let's vote. Voting, voting, voting. What would you like us to talk about? Ovulation or PCOS? We need more people to vote. Just check down. You see the link to vote, the poll. So vote. Which topic would you like us to discuss tomorrow? Do you want us to talk about ovulation or do you want us to talk about PCOS tomorrow? This live is almost coming to an end. After this live, for those that really want to know their cycle, I'm going to be putting the board and I'm going to be spending another 20 minutes from, let me say, 11:05 to 11:30. So I'm going to be spending another 20 minutes talking about how to calculate your cycle. All right? So if you are interested in that topic on how to calculate your cycle, not necessarily ovulation, stay back and turn on the notification bell because I'll be coming back after 5 minutes just to have some sips of water to tell you about cycle if you want to know about your cycle. All right? So I'm going to be using my camera to go live. I can't use my phone like I earlier said. So Florence said, I want to discuss everything about ovulation. Ayika John said PCOS. Florence said ovulation. Okay, let's vote in the comment section. Vote in the comment section. Vote in the comment section. Sorry, in the pool. In the pool, not the comment section. The pool is going to tell us what we are going to take tomorrow. Ovulation or PCOS? PCOS is taking the lead. PCOS is taking the lead. Can we make the like in this video up to 20? We have 19 likes already. Just double tap the screen and it likes the live section. We've had a lot of people coming and going. Can you just make it at least 20 likes? Double tap the screen and it automatically likes the video. So for the now, ovulation, 33% want us to talk about ovulation and 67% want us to talk about PCOS. Florence, is it that we merge the topic together? Let's see how it goes. Let's see if I'll be able to inculcate ovulation inside of PCOS. Because if I should discuss PCOS, looking at it, if I should discuss PCOS, you need to have an understanding of ovulation. For you to have a better understanding of PCOS, you need to understand ovulation. I think they go hand in hand. Because irregular cycle is more or less like irregular ovulation. And that is like PCOS too. Thank you very much for the person that double tapped to like, click, make it 20. But you can double tap more, like the live section, okay? So tomorrow, we are going to be talking about PCOS with a touch of ovulation. Then if you have any other question, you can ask in regards to ovulation, okay? So Florence Azubike, you are not left out in tomorrow's live. We're going to be talking about your question tomorrow. So, Christopher Pamba, what's the question? I didn't get your question, Christopher. If the question contains some words that are not appropriate on YouTube, it's not going to appear. So I think people should be careful when typing your questions on the comment section. If it violates their policy, the questions are not going to appear on my screen. All right. So for the now, we still have 67% wants us to talk about PCOS and 33% wants us to talk about ovulation. So I have to go and do an elaborate study on PCOS. I have a background knowledge on PCOS, how it works, but to actually give you a detailed lecture on it, I have to go and study more about it and come and give you what I've read and studied and know and experienced about PCOS. Okay, so 71% actually wants PCOS. So PCOS is taking the lead. But we're going to be doing PCOS tomorrow with some touch of ovulation. And if you want me to calculate your cycle, like I earlier said, 11:05, after I finish recharging, I'm just going to spend like 15-20 minutes on the next live, and I'm going to end the live depending on how many people shows up and they want their cycle to be calculated. That particular live is specifically dedicated to calculating cycle. So if I get people that want to calculate their cycle, I'm just going to bring my board and calculate the cycle. But if we don't have much people calculating their cycle, I'm going to end the live as soon as possible. All right. But this particular live is ending in 5 minutes time. So Florence, you're welcome. Florence, you're welcome. Christopher, I can't find your question. Probably it actually validates YouTube policy or something. So Blessing Duru said, okay. Yeah, okay. So if you want to calculate your cycle, I'm going to be popping my face 11:05 in a fresh life. By then I would have recharged a little bit. I like taking breaks. Breaks are very important. Okay. So we're going to be naming that live calculating your cycle. So is there any question? This particular live will be ending in 3 minutes time. If there's no question and you are interested in joining our live, semen analysis. So what are you asking about semen analysis? Semen analysis is you ejaculating, taking it to the lab, and they check it out. Can a woman get pregnant with low sperm count? It's difficult. The chances are slim. The chances are slim for you to get pregnant with low sperm count. Though there are sperm, which is 5 million, but the chances are slim. Compared to 15 million and 5 million, they are not mates. You understand? So the chances are actually slim getting pregnant with low sperm count. So when couples are trying to conceive and the man has low sperm count, he has to check the diet, he has to check the lifestyle, he has to check if he has any medical condition and intentionally improve his sperm count. Okay? Because sometimes that low sperm count is slim. Chances are slim of getting pregnant with low sperm count. They are slim. But they are not totally impossible. But they are slim. Slim chances. So we have Ike. Ike said hi. How can it be improved? I see Blessing Ome. We talked about how this can be improved depending on what is causing the low sperm count. All right. It all depends on what is causing the low sperm count. So if it's an infection, you have to treat that infection. If it's a medical condition, you have to sort out that medical condition. There are some food we listed in this live section that you can eat that can help you boost your sperm count, like some food rich in antioxidants, some food rich in zinc. We talked about food like your green leafy vegetables, your walnuts, your berries. All these foods are rich. Those natural food, your citrus fruits, all these things are rich. They are things you need to actually help you boost your fertility, your sperm count as a man. Why are you afraid of my life? Why are you showing your face on my life? Blessing Oye said, is this live recorded? How can I play it? Yeah, when the live ends, it's going to surface. When the live ends, you're going to see it. So Christopher said, how long should you stay to do semen analysis? When you go to the lab, you don't need to stay long. When you go to the lab, they get their sample. I think they will get it sorted out. I don't really work in a lab, but they get sorted out. So we actually finished. Oh, I think more people have started voting for ovulation again. But in any way, we're going to be talking about PCOS with a touch of ovulation tomorrow. So that's what our discussion tomorrow. Ike said, thank you for the food that I must eat. Is in the live video. As in the live video, you can play the video after the live section is gone. So you just have to be patient. After the live section, I believe in 2-3 minutes, the video is going to pop up. Then you're going to see it. All right. So thank you very much, everyone, for joining our live section today. I believe it has been engaging, it has been interacting, and it has been educative. So thank you all, and see you in our next live section tomorrow, where we are going to be talking about PCOS and ovulation. For those that really want to know how to calculate their cycle, I'm going to be coming back in the next 5 minutes to talk about ovulation for a bit. We just calculate your cycle for those that want to calculate their cycle. So I'm going to be back for 15 minutes period, 15 to 20 minutes. We'll just talk about, if you want to calculate your cycle, you let me know your dates. I'll help you to calculate your cycle. Then the live ends. All right. Thank you very much. Bye, and see you in our next live section. Do marijuana affect low? Yeah, marijuana can affect your sperm count. It can cause low sperm count, John. Bye, everyone. Why are you showing your face?